Good evening, everybody, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here tonight with Dr. Richards. And tonight we're going to be talking all things dental implants. So welcome. We're so glad you're joining us tonight. And so we'll go ahead and jump right into things. How are you doing, Dr. Richards?
I'm doing well, thanks.
That's awesome. So to learn a little bit more about Dr. Richards, he is a board-certified oral and maxillofacial surgeon since 1982, so you have over 40 years of dental implant experience, and you're one of the innovators of New Teeth Now. Can you tell us a little bit about, what New Teeth Now provides for our patients, that, why you innovated it?
Well, we were looking for a solution for people to get some teeth quickly.
Mm-hmm.
People want teeth quickly. They don't want to wear dentures for 6 months while the implants are healing. And so back maybe 20, 25, maybe 30 years ago, we began experimenting with immediate loading of dental implants, and it was very successful. And so what we're doing now is probably a 30-year evolution of using various techniques in order to give people teeth immediately, yes. Not the next day, not a week later, not 3 months later, not 6 months later, but so they can have some teeth on the day of the procedure. Now, those teeth are not the final teeth. There are some people around the country who advertise that they make the final teeth on the same day or the next day. And we've done that, and we have elected to pull away from that because there's so many changes that happen when this procedure is done that you just can't make the final teeth the same day or the next day.
Right.
There's just too many variables and too many changes that need to be made. So what we're doing now works. It is reproducible. Dr. Kirkpatrick and I do one of these every day, and by and large, people that have this procedure are very happy. May not be happy the first day or two, but after a few days, when the dust settles,
yes.
They're very happy. And we've innovated some new virtual techniques that we're using now in the lab that enable us to make sets of teeth quickly and make changes that need to be made quickly, which is even better. So
yeah,
it's
been really awesome.
Been an interesting ride, really, over the years.
So to learn a little bit about what a fixed upper hybrid is, can you tell our viewers what they're seeing right here?
Well, fixed to us means it doesn't come out. So it's fixed into position. The upper is pretty explanatory. The hybrid means that, to me, what a hybrid bridge is a bridge where the implants and the teeth do not have to be lined up together, so to speak. If you're placing implants for a regular bridge or for a single tooth, the implant has to be pretty much dead on the money, right where that tooth is going to be, so the crown that goes onto the implant will look natural. But when you have people who come in that have a lot of bone loss, the implants have to go where the implants can go, where the bone is, and then the teeth have to go where the teeth have to go in order to make things look good, to support their lip and face, and also chew well. So they have to look good, they have to chew well, but sometimes the implants aren't in the right spot. So the hybrid bridge is a bridge where the implants and the teeth are sort of disassociated from one another. Yet they come together to make a prosthetic device that looks like teeth, that chews like teeth, but it's really a prosthesis,
right,
that is screw retained onto the implants.
That's pretty amazing. And then similar
in the lower,
as well.
Yeah, basically the same thing. Back in the early days, we did a lot more lowers, and
Right.
was approved, FDA approved for lowers before the uppers were approved. And now it seems like I think we do a lot more uppers than lowers,
Yes,
maybe.
I would say, yeah. So we'll kind of go over the day of surgery and what that looks like. So early in the morning, you'll come in here. We will put you in a deep sleep with general anesthesia for a pain-free procedure, so you're completely asleep the entire time. First, your teeth will be extracted if needed, and then Dr. Richards will place all of the implants that you need. While you're still asleep, impressions will be taken for the upstairs dental lab to customize your teeth. Then you'll wake up in a private recovery room while the in-house lab is creating those teeth. And in the afternoon, right before you go home, the teeth are placed in the patient's mouth and adjusted. So that, you'll come in about 7:30 and leave about like 3 or 4.
Or 5.
Yeah. And that is...
And Bianca makes it sound so simple. When really it is simple, because we are set up to do this. We have everybody here all gathered up in one place, and we do this every day. So this is what we do. This is what we're known for. This is what we do. And this slide makes it look so simple. But as I said earlier, what we're doing now is an evolution of many hours of,
Yes.
Playing with different techniques and that sort of thing. But this works. It works predictably on every person that we accept as a patient. And it works every time.
It does.
Yeah.
It's very great. And one of those evolutions that we talked about is that it's all in one day and all in one office, which is a big difference. So we have the 3 rings here. They all intersect for our facility. We have our surgeons, our restorative doctors, and our dental lab all under one roof. And can you explain why that makes such a big difference for patients?
Well, I'll tell you, I'll bet you in 30% of the people that come in here who have been around to other places. I saw a person today from North Tampa, and we were the 3rd office that they had visited. Mm-hmm. And one of the reasons that they really liked us is for this slide, that the surgeon, the restorative dentist, and the lab were all in one place. So that is something that both Dr. Kirkpatrick and I hear a lot. I'll bet you probably 30% of the people that come in say that's why they came here, because everything's in one place and they didn't want to have to get up and drive to different offices. So we felt this way, probably 2009, 2010, and then we opened our own lab 2013. So we hired our own dentist. It's been so long now, I can't remember. I think we hired our own dentist probably 7 years ago, something like that. I'm not getting that old, but I am losing track of time because it's been such a long time.
Right.
I mean, it's hard to believe we opened that lab in 2013 and now it's 2021.
Yeah.
It's been 8 years. But Dr. Dibbs, our restorative dentist, has been with us a long time, and then Dr. Nafala, we have a part-time restorative dentist, and we just hired a new full-time restorative dentist. So we have the surgeons, we've got 2 full-time restorative dentists and 1 part-time restorative dentist. And we have the lab, and they're probably 10 employees in the lab.
Yep.
We don't outsource anything. Everything is done here. It's taken, folks, I got to tell you, we didn't fall off the turnip truck yesterday and have this happen. I mean, it has taken a long time to get to where we are, to get to where things work this smooth. It really has, yeah.
Definitely. And for a physical location, this is our office. So you'll see in the back, there's a dental lab upstairs and then 2 operating rooms on the lower floor. And then lots of different patient rooms throughout. So we're a large facility. We have a staff of about like 50,
60,
maybe 60
yeah.
now. Yeah, so we definitely, all those working parts really help to bring the best experience for our patients. Well, actually, we had a question. So let's answer this question before we go into our testimonial. Do the elderly need surgical clearance?
Yes. We call that a medical clearance. Not only elderly, but some not so elderly need medical clearances, and it all depends on your health. I mean, there are people in their 40s that need medical clearance. So if a person has a physician, a medical doctor, and they're on medication for whatever reason, blood pressure, irregular heartbeat, or whatever particular problem they have, then that person, we're going to request a medical clearance for general anesthesia from that person's physician, whether they are elderly or whether they are not elderly. If someone is under 40, they fill out a medical history form, and under a review of their various systems like cardiovascular, pulmonary, GI, and everything, if they have no problems, they're under 40, they have absolutely no medical problems whatsoever, and they aren't on any medication, those people, we assess them ourselves, and our nurse anesthetist assess them, and those people do not need a medical clearance. But like I said earlier, I don't need to repeat that. Other people do need a formal medical clearance before we'll put them to sleep under general anesthesia in our office, because we're talking to do a full mouth procedure about 4 hours, and we're not talking twilight sleep with IV sedation. We're talking a breathing tube through your nose down into your trachea. You're hooked up to an anesthesia machine that delivers a gas called sevoflurane, and you're on a ventilator, and it's 4 hours of general anesthesia. So we don't take that lightly, and we treat our facility just like any other outpatient surgical facility.
We will go and learn a little bit about Nathan. So he is a reptile trainer and wildlife conservationist. He actually sustained a facial injury from an alligator accident that ended up leading towards the decay of his teeth. He had constant oral pain and felt like he had degrading overall health. So we're going to hear a bit about his story now.
When people are afraid, they freeze. So when you freeze up, that will get you killed in my industry. I mean, there's definitely a very, very healthy respect. I've been studying, behavior and all that stuff specifically with alligators and crocodiles and what I work with and train for almost 30 years. I'm not fearless, but I don't ever let fear in the room. One of only 2 times that I was bitten by an animal in my entire life. One of them happened to be square in the face. So I was doing gator wrestling shows, feeding demonstrations, all these different things, and I was kind of laying down on a dock similar to this, and I look over my shoulder and there's another alligator that was spooked by the activity and was already in the air. So as I turned to look over my shoulder to hear what the sound was, here I am turning my face right into a jumping alligator's mouth. And it was about 8 feet long and it clamped onto my face. Now you got to keep in mind, about an 8 to 9 foot alligator is going to have well over 2,000–3,000 pounds of pressure per square inch in its jaws. So a nice good chomp is going to do some damage. So it's slashed up through the cheek, kind of starting down here by the, almost the gum line really. Back over here, through the cheek, through the nose, broke my nose in a couple places. Tooth pain, especially those exposed nerves. It was like this constant, non-stop, incessant pain, as if somebody had like a small little pen knife and just stuck it in there and would just kind of be twisting it. It started getting to a point to where it was affecting overall health. It wasn't just a, appearance thing and then, being a little self-conscious. I heard the ad come on the radio and I was like, okay, well there's a option for a solution. Plus doing it in one day, I mean, you're not really out for the count for too long, work-wise and everything else. Anytime somebody tells you to count backwards from 10 and the next thing you know, you're waking up all like, what's going on? You know, and something new has happened. You know, it's a little, I guess nervous is probably the right word, but excited at the same time.
Drinks on me later.
Okay.
Doing the New Teeth Now experience from when I got to the office at 7:30 in the morning to get prepped for surgery. That was like one of the best days off I've had in a long time. It was such an easy experience and it flowed so well.
Looks pretty good.
Looks like new teeth now.
Congratulations.
Thank you very
Yeah.
much, sir. Excellent work. New teeth now.
I married that man.
I was excited to see how much energy I would actually have, like once my body wasn't trying to compensate for, you know, this crazy weird pain thing that was constantly going on. Right away that day, I think when I was coming out of the anesthesia and I was starting to really get my wits about me again, I mean, I could almost notice it right away, like, it was like taking a deep breath of fresh air, like, okay. I don't want to say I feel younger, but I feel younger again. You know, it's like the fountain of youth.
So yeah, what an awesome story. We just loved having Nathan around, but now he has his life back. He feels energized. He feels younger. Like, just feels like a totally different person.
Yeah, I mean, what can you say? The video, you know, our guys do a great job with the video. Nathan is really a unique individual, and you put all that together, and it's a great story.
Mm-hmm.
The only thing I regret is that I haven't been up to his place yet.
I know, you gotta go visit.
Yeah, need
See
to
all
go
the
and see the
animals.
alligators.
Yeah. So we'll kind of dive into the implant structures. Do you want to tell our audience what they're looking at here?
Well, this is an X-ray view that we call a panoramic view. It shows everything from all the way around the left to the right, upper and lower. And these are what we would call a kind of traditional run-of-the-mill kind of procedure where the person has plenty of bone in the upper jaw and the lower jaw for traditional implants, traditional length, traditional diameter. And also that the sinus has a favorable slope so that the tilted implants may be placed far enough posterior that we don't have a long cantilever on the teeth. So we need, if you think about the teeth as a table, you need legs on both ends and some in the middle. And that's what we try to do with the placement of the implants. And we don't want to get the implants jammed up too close together, but we do want to have them spread out so we have optimal force distribution, so to speak.
And this is Zygomatic implants, which is, it's for bone loss. It's kind of a different process with these.
Very similar in the lower. There's 4 sort of in front of the nerves, so to speak, and 2 more posterior in the lower jaw. That's the bottom part of that. And there's 2 tilted ones there to tilt in front of the jaw nerve. But in the upper, there was bone in the anterior upper jaw to accept 4 traditional length implants placed in a traditional fashion. But in the posterior, there was an unfavorable slope to the sinus, and the sinus dipped down low, so there was no bone in the back. No bone in the back of the upper jaw. Trying to put that in layman's terms. No bone in the back of the upper jaw. That's when we use zygomatic implants. This bone, the cheekbone, is the zygoma, Z-Y-G-O-M-A. It's your cheekbone. Therefore the name zygomatic implants. They are only used in the upper jaw and they go into the cheekbone. And they're used when there's not enough bone in the back of the upper jaw. The benefit of zygomatic implants is no bone grafting, and you can attach teeth to them the same day. The alternative option is a sinus lift. And with a sinus lift, now you're looking at your treatment time extending out to maybe sinus lift, heal 6 months, place implants, heal another 4 or 5 or 6 months, and then get teeth. So going traditional sinus lift bone graft, you may have a 12-month treatment time before you get teeth. With zygomatic implants, you get teeth in 1 day. You get teeth the same day. You get your teeth now. And so we went to zygomatic implants back in 2007, and we've never looked back. They work wonderful. They work great.
Yes, and we place them so frequently. We're probably one of the #1 in the country of placing these. So
I mean, Dr. K and I may do each 10 a week.
Yep.
And we may do 20 zygomatic implants a week here in this office. So we use them a lot.
If you do have bone loss, definitely consider zygomatic implants. And this is quad zygomatic implants. So this is if you have like really barely any bone.
No bone in the front of the upper jaw. No bone in the back of the upper jaw. Now this particular x-ray shows where there's a little bit of bone in the very front of the upper jaw, because there are 2 traditional short implants. And the zygomatic implants, a little more to the back, they both go into the cheekbone. There's 2 on each side, so it's called a quad zygomatic technique. And in this x-ray, it's supplemented by 2 short traditional implants. And this is also a common technique.
And is recovery time any different between traditional and zygomatic implants?
No, the recovery time is about the same. To place the zygomatic implant, it only requires the reflection of a little more tissue. A flap of tissue has to be reflected to do even traditional implants. To do zygomatic implants, we just reflect the tissue a little higher so that we can see. Placement of zygomatic implants is a direct vision procedure. It's not blind. We're not just like poking implants up into the cheekbone blindly, because the eye socket is up there. And so it is a direct vision procedure where everything is reflected and retracted so that we can see all of the anatomy clearly. You've seen many.
Yes.
And you take pictures of all of them. So there might be one other slide that shows 4 zygomatic implant. Well, this slide, and if you look on the left, these are also common where there's no bone in the front, no bone in the back. I'm talking about the upper jaw now. And so it's purely 4 zygomatic implants. No room for any extra traditional short implants like you see in the right or the center. The left is no bone front or back, and about the only solution is zygomatic implants or extensive, go in the hospital, take hip bone type bone grafting, which takes months to heal. So, the zygomatic implant just in our practice has revolutionized the atrophic, a word that we use, I shouldn't say that word, the upper jaw where there's no bone.
Yes. We did have a question come in. What happens if you already have partial lower implants? Do you remove them or use them?
Both. Sometimes we use them, sometimes we remove them. And there are some variables depending on the depth of placement, depending on the angulation of placement. How old are they? Can we still get parts for them?
Yes.
So there's some variables, but sometimes we use them and sometimes we don't.
Right. And this is Dr. Richards' team. So Angie, Allie, and Ashley work with you every day in surgery with follow-up appointments. They're great. They're a great group of girls.
Yes, Angie on the left, Allie to my left, and Ashley on the far right, and they've all been with me for quite a while now, and without them, I couldn't do what I do. They're all good folks, very competent.
Yes.
Yeah.
And this is our anesthesia team. So we have Jack Daniel and Kim Cherry. They have over 30 and 25 years of anesthesia experience. So you're definitely in great hands as far as anesthesia. And they are registered nurse anesthetists.
So Dr. Kirkpatrick and I work with these two people every day when we come to work. Pretty much every day I do one of these procedures that we're talking about. They're 4-hour procedures, and so I'm with one of these two people 5 days a week from 8 to 12:30 or whatever, and I would let either one of them put me under general anesthesia. These are very experienced, conscientious, good folks, or we wouldn't have them here.
Exactly.
And so I can't say enough about both of them. Of course, everyone always gets a kick out of, they want to be put to sleep by Jack Daniels. Whether you drink or not, Jack Daniels will put you to sleep. So, but anyway, we got a great anesthesia team. Now we do have a couple of other, sometimes these people go on vacation.
Yep.
And they do take some time off, and we have two other nurse anesthetists, Steve and Ashley, who sub in. And it's rumored, Jack's rumoring that, maybe next year sometime he may filter out a little bit, and work a little bit less.
All
we'll
right.
see. So, but anyway, good people.
Awesome.
Help us out a lot.
Definitely. And this is Dr. Dibbs, who Dr. Richards mentioned previously. He is a prosthodontic specialist and restorative doctor. So he is the one who will help you, design and fit your teeth. And so we're going to just learn a little bit about what he does and how the lab and him work together.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no wait-in. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
We had another question come in talking about if they've already had their teeth extracted, can they still have the procedure?
Sure they can, yeah.
What's the next step for them?
Well, the next step would be to come in and have a consult,
Yeah.
which you're going to talk about at the very end of this.
Yes.
But yeah, whether you have teeth or whether you do not have teeth, it doesn't make any difference. What's important is the bone, how much bone you have or you don't have, and where it's located. And so we see that from a cone beam CT scan, which we can take. Or if a person has one, they can bring it in on a disc, and most of the time we can look at it. But that shouldn't be a problem. Having teeth out already is not a problem.
So, talking about, the different types of teeth, we have a really good example showing the zirconia final teeth versus the acrylic, which are temporaries. So if you look here at this image, the zirconia teeth are sitting on top of the acrylic teeth. Both teeth have been worn for 5 years, and you can see the wear on the acrylics. So they're kind of dingy. They absorb some of those stains. They just look, like they need to be replaced. Whereas the zirconia teeth look brand new. They're super shiny and reflective. They look super natural. So that's why we always place zirconia final teeth. It's really just a major quality difference, and they're the strongest material that you can get for the teeth.
Yeah. This might be a good time to tell everybody about something that we've recently started with the third set of teeth.
Yeah.
And so the bottom teeth, the acrylic teeth that you can see on this slide, are denture teeth. Those are individual denture teeth that are adhesed or held by the pink stuff, which is denture acrylic, the same stuff that a complete denture is made of. And so that is the type of teeth. These are handmade. This type of teeth is handmade by our laboratory technicians on the same day, and that's what we place into a person's mouth on the same day as the procedure. So what we started doing, we started scanning these teeth into a software program before we place them into the person's mouth. And then on the first post-op checkup visit, which is generally about 7 to 10 days following the procedure, we are able to place a second set of temporary teeth. And this second set of temporary teeth is milled out of a solid block. The zirconia is milled out of a solid block. And the second set of temporary teeth that we're now making is milled out of a solid block of reinforced material called PMMA. It's a type of acrylic. I don't know all about the chemistry about all that. And so we take the acrylics out, and we put the milled reinforced acrylic teeth in at the first post-operative checkup visit. And those teeth are then, the files to make those teeth are stored in that software. So once we get down the road with healing, if the person says, maybe the midline's not just perfect, maybe I want to bring the teeth down or move them up, maybe I'm showing too much lower teeth, we can go into the software and make changes in the software, mill out another set of teeth, and when they come in for a visit, we can exchange those teeth. So this we just started, and the reason that we started this is because we have been seeing so many people from out of the state, people from like northern Vermont, and we've actually done this procedure on people from every state except North Dakota. And so once we started seeing a lot of people from out of state, and we don't want them to get to Nebraska and have something break.
Right.
So these intermediate second set of temporary teeth, which are made out of this reinforced material, they just don't break. So we're making those now for even our local Florida people. We're definitely making them for our out-of-state people as well.
Yeah.
And, you know, we're sending people home with a little driver and a little set of screws, so we have a little tool kit. And so if they get off somewhere and there's a little problem, they have everything necessary to take care of that. So, but we do not, our final teeth are all zirconia, they're not acrylic.
Yeah, that's awesome that we're starting to do that. I hope that'll really be a game changer for our patients.
How long did the teeth last? Probably longer than you. The teeth last a long time.
Mm-hmm.
I've been doing this since 1980 here in Lakeland, and I'm just not seeing people coming back with things failing.
Yes.
These types of procedures are very long-term stable. These teeth are very long-term stable. I can't give you like an automobile with a 10-year warranty or a 100,000-mile warranty and that type of thing. But I can tell you that in my experience, which is I think a lot, because I've been doing this a long time. Specifically, I've been doing this a long time, and I just don't see failures.
Yeah.
The other question is, can you floss? You are not able to floss in between the teeth because this is a bridge. When you have a bridge, whether your bridge is connected to teeth or whether your bridge is connected to implants, everything is connected. So you cannot floss in between the teeth, but you are able to floss under the teeth, between the teeth and the gums. So you have to keep that area clean. But you don't floss in between the teeth like you would with your own natural teeth. Mm-hmm. Because it's a bridge.
And these are our implant coordinators, Shauna, Debbie, and Mara. Mara just joined us about a month ago, and she's already doing an awesome job. But these are one of the ladies you will see when you come in for a consultation. They will walk you through the entire process, answer all of your questions, and really are just there with you every step of the way to make this process as smooth as possible.
Yeah, Shauna and Debbie have been with us for over 20 years.
Mm-hmm. So at our consultation, it's about a 1-hour appointment. We'll take a CT scan or a CAT scan, iCat scan, and we will Dr. Richards will develop a treatment plan and go over that with you in the consultation, so you will know exactly what would be happening on the day of surgery. And this is, just part of the scans that he'll go over with you. So it's really in depth. You'll know, the placement of implants, all that sort of thing.
Right.
And this is a good overview of the entire process. So you come in for a consultation. If you decide to move forward with treatment, we'll schedule surgery. You'll come in a few days before for a pre-op appointment and an impressions appointment. At the impressions appointment, you'll be working with Dr. Dibbs or Dr. Nafala, creating, what you'd like your smile to look like. And then you'll have surgery day. A few days after that, you'll start your post-op treatment or post-op appointments, and that is within 6 months. So it's going to take that long for your implants to fully heal. Once they're healed, you'll create the final teeth. So any changes you want made between the temporaries and the finals, that will happen at that step. And then we'll place the finals and you'll be all set. So we're going to watch a final video with Karen. She is one of our patients, out-of-state patients from Pennsylvania. She wore an upper denture for about 15 years. She did have some dental anxiety as well, which a lot of our patients experience, but we were definitely able to, calm her, fears about the whole procedure, and we'll hear her story now.
To go through life not worrying about your teeth is going to be so amazing. I'm a YouTube creator.
Within 2 days, and I got $200 for them. Yep, $200 for an item I have no clue about.
Before I had my dental implants, I deleted a lot of the videos that I made for YouTube because I would make a video and it's a little surprising to see what your teeth really look like. It's almost worse than what you think. When I first started looking into dental implants, like I said, I researched a lot. I actually looked at going out of the country because of the cost. And I didn't feel confident in that because I knew I'd be traveling on my own. So coming to Florida from Pennsylvania, I knew I would have to stay in a hotel, and I wasn't quite sure how much of a challenge staying in a hotel room by myself would be. But when I called New Teeth Now, I spoke with Shauna and Nicole, and let me tell you, I've never met, and this is the truth, such gracious, helpful people. They helped me find my hotel room. I mean, even during my trip there, they made sure I got on the plane safe. They called me when I landed. They brought me to the grocery store because they knew I didn't have a rental car. I didn't rent a car because I knew I'd be on medicine. You know, I figured I can't be driving. They brought me to the pharmacy to pick up my prescriptions. So the travel was great. Pennsylvania to Florida is only a 2-hour trip, so that was great. And I had a hired driver to go from the airport to the facility. So in the morning when I arrived, I really didn't have too many thoughts because I felt confident in the surgery team. I had met everybody. I was joking around with the anesthesiologist, like, just let me have a good nap. I wasn't anxious about it. You know, I felt like the whole team has my best interest at heart. As I woke up, I was shocked that I didn't feel anything. I really expected to be in pain. I didn't even need to take the stronger pain medication. The professional level, the caring, just the attention to detail at New Teeth Now, I've never experienced that. You know, I felt like the whole team has my best interest at heart. When I met somebody new before I had the implants, I felt like I could see the point, at what point in the conversation they would be looking at my mouth to try to figure out what was going on with my teeth. And now I feel just more relaxed, and I think it's more engaging because I smile bigger. You know, I think I put the other person more at ease because it's not awkward. You know, I just feel like I can be myself. So that's been huge. I was in with one of my regular buyers. They said, wow, you look young. Your hair looks great. What happened to you? And they didn't even know it was my teeth. And I was like, oh, thanks. That was amazing. I knew it was my smile. I feel like just being able to relax in life and enjoy life, and when you're complimented, it strikes you as like, wow, I'm not worrying about this anymore. Definitely life-changing, yeah.
So it's really just awesome how she can just relax and really feel herself and not have to worry about her teeth or be self-conscious. And you know, now she hosts her YouTube channel and she's super confident and does really well with it. So we're really happy for Karen. And this is Bruce. He's from Orlando. He had a lot of dental pain. He couldn't eat the foods he loved, which was really important for him, and now he can eat anything he wants. So that is also a big point, that, you know, you can eat anything you want once you get your final teeth. And this is Gladys. She's from Tampa. She had difficulty chewing, she had infection and embarrassment, and so that was just all cleared up for her in one day. But we really just, if you have been with us through this whole video, New Teeth Now is probably a procedure that you need. And so we really just encourage you to learn more, ask us questions, and, you know, when you're ready to make the next step, we'd love to see you for a consultation. We really thank you for joining us tonight. Thank you, Dr. Richards, for being here.
I would just encourage everyone to go to our website. There are a lot of patient testimonials. There's a lot of videos. There's a lot more information about our business that we have not been able to give you guys tonight.
Yeah, I definitely encourage you to go on our website. There's so many resources. And then you can always, you know, chat us and ask any other questions you have. All right, well, thank you for joining us, and I hope everyone has a wonderful evening.
Thank you.